Good afternoon. This is episode 16 on Wednesday, July 21st, 2021. This is day 54, nearing the end of week 8 post-shoulder surgery for me. In this video, I'll go over my progress since my sling has been off, pain, sleep, range of motion updates, helpful physical therapy additions, and maybe the most important, at the end of this video, I'll give you 3 important tips for making this phase of recovery easier. On July 7th, just 2 weeks ago, my surgeon told me to take off the sling and get comfortable being without it. Well, I took that advice. I thought I would be phasing my sling out, taking it on and off, but I haven't worn it since the appointment. I won't need it, and I'm not looking back. I've increased my ability to do normal things. Those things are getting easier and easier. Things like washing my hands without leaning over the sink, opening the refrigerator and other doors, eating with my surgical arm for short periods, using the mouse on my PC and typing on the keyboard for longer periods, and lifting my elbows up and moving them around. Sleep continues to improve. Not all nights are the same, but the trend is upward. I still can't lay on my surgical side without introducing pain, but it's been far more comfortable to lay on my back or my good side. The most comfortable position for me is lying on my left, good side, and resting my arm on a big puffy pillow in front of me. I can stay in that position for longer periods now. When I talk about pain, I mean a constant pain or a continuous pain in my shoulder. It's there most of the time. I haven't had any of that since day 10. You can see this pain graph in the video card or in the show notes below. However, it is totally normal to have discomfort and quick, brief feelings of pain when going through physical therapy and beginning to do normal things again. My range of motion continues to be really good. I haven't measured it on a goniometer for weeks, but I haven't lost anything. In fact, I may have gained range of motion. You can see that same range of motion graph in the same linked video in the card or in the show notes below. Unfortunately, I've been without my physical therapist for this entire portion of physical therapy, so it's all been done on my own at home. I've been feeling super successful with the things that I'm doing, including some additions. I'll go over those shortly. As you may have seen in last week's video, during the first week I did external rotation with a 3-foot PVC. With that same PVC, I did abduction and flexion. I also did child's pose, overhead with a pulley, abduction with a pulley, dead hang position, light wrist curls, and shoulder circles. For the second week, I added the following movements: front raises, which is a variation of flexion, towel pushes, low, towel pushes high, heavier wrist curls, bicep curls with no weight. I did 2 sessions a day for the first few days and increased to 3 sessions a day. I also did mini sessions, which I'll describe later in this video. When I first started active assisted range of motion, I was sore and achy the first day or 2. I could definitely feel it. I could also feel my shoulder getting more tired when I gave myself less assistance in those same ranges of motion. I'll give you more on that in a bit as well. 3 tips for making recovery easier. The following 3 tips have been huge keys to helping me feel better and make really good progress. Number 1, pack the shoulders when performing movements. With a healthy shoulder, it's easy to just raise an arm or push it out without being intentional, especially without a load. Our shoulders are designed to take a bigger load, so just moving the arm with a healthy shoulder is no big deal. At this point of recovery after shoulder surgery, just the weight of an arm with assistance is a heavy load. Under load, packing the shoulders helps make movements easier and more efficient with less chance of injury. It also allows the humerus to efficiently move in the shoulder or the glenoid joint instead of getting caught and clicking. After shoulder surgery, tendons and muscles are not used to moving. There's a lot of laxity. Packing shoulders helps mechanics a lot. In fact, one of the first days doing active assisted range of motion, I felt a pop and it really worried me. I later realized it was just simple laxity in that shoulder joint. I've heard it many times since. Primarily, it will help things hurt far less. I use this method and it's helped me a lot. What is packing the shoulders? Packing the shoulders is simply retracting and depressing the scapula. Imagine someone holding a pencil between the shoulder blades. Now try squeezing that pencil without letting it drop to the ground. Now push the shoulder blades into the back pockets. Maintain that tension while doing a range of motion movement, while flexion, abduction, or even pushing a towel. It's really hard and awkward at first, really awkward. This is one of those secrets the best weightlifters in the world use. They can do it automatically through years and years of practice. At first, I didn't pack my shoulders, and it was a really unusual feeling in that shoulder. It just slipped my mind. Once I started packing my shoulders and maintaining that position through my movements, it helped immensely. Number 2, use mini sessions often. During each physical therapy session, I made a lot of effort to get into all sorts of different ranges of motion that I was working on. My shoulder always felt more free afterward. 1 or 2 hours later, I lost range of motion and felt really stiff again. But unfortunately, that's normal. So how did I combat that? I started using mini sessions. Mini sessions are a 2 to 5 minute light version doing an easy version of important movements. I used external rotation, abduction and flexion with a 3-foot PVC in the supine position on the floor or in bed. I made sure to pick really easy stretching movements and I went light. I didn't push into range at all. This freed up my joint and got rid of that stiffness. I started with 1 session between my normal, longer physical therapy sessions, and I worked up to doing 3 to 4 mini sessions every day. In total, that's 3 full physical therapy sessions and 3 to 4 mini sessions. The full physical therapy sessions take 15 to 20 minutes, and mini sessions took me about 2 to 5 minutes. Doing the mini sessions regularly between my normal physical therapy sessions really helped my shoulder feel better. It also helped longer physical therapy sessions because I could get into better range of motion with way less effort. The mini sessions helped me significantly. Number 3, expect a roller coaster ride. If you're anything like me, you're going to have your ups and downs. You push yourself one session and you're more sore the next session. You push into a certain range and an hour later you lose most, if not all of that range. You experience little pains here and there when doing things. When I consistently kept pushing range of movement, several days later, most of those pains and sometimes all of them completely disappeared. As an example, when I was going into flexion using a pulley, at first it would hurt in certain ranges, simply using the pulley to lift my arm. After several days of doing that same thing, it felt smooth as butter, no pain at all. It was amazing. Next, I would apply a little more force on that surgical arm by using less assistance with my good arm, less assistance on the pulley, and it would hurt again. Several days later, it was as smooth as butter, no pain. So in other words, when I first moved into doing something different, it was difficult and sometimes gave me a sharp pain. The more I did that different thing, the less it hurt and the pain eventually went away. I continued to rinse and repeat, moving into something different. When doing anything in recovery, if you have increased pain, swelling, or loss of mobility, those are signs you may have pushed too hard and need to lower your intensity or frequency. Understanding that I am on a roller coaster ride, using those mini sessions and being sure to pack my shoulders for all of my movements has helped me immensely. You're going to make gains and quickly lose most of that progress, even in the course of an hour. Then next time you'll have to get most of it back again. It's a constant battle and a roller coaster ride. However, if you are consistent, you will make gains every day. If you make those small gains every day, you will eventually reach your goals. This isn't a sprint, it's a marathon. It's not easy. It takes work. It takes a lot of work. It takes consistency. Keep at it through the good days and the bad days, and you will get there. That's all I have for you. See you soon.